Hello, I'm Dr. Nicole Iovine, and I am the Chief Hospital Epidemiologist at UF Health. There's been a lot of talk about monkeypox in the news lately, so I'd like to share some important information about who is at risk for this infection, what the symptoms are, and how you can keep yourself safe. First of all, a recent study by the Centers for Disease Control and Prevention reported that 99% of all monkeypox infections are occurring in men after intimate contact with another male. If there are sores in the nose, mouth, or throat, monkeypox can also be spread by respiratory secretions. In addition, monkeypox can be spread by contact with items like clothing, bedding, or towels, if those are shared with the person who has monkeypox skin lesions. Because of these additional potential ways to become exposed to monkeypox, we do expect that cases will start to rise in other populations, including women and children. It is important to remember that the main way monkeypox is spread is by prolonged, close contact with an infected person who has the rash or their personal items like clothing. That means that brief, casual contact with the person or their items is not likely to lead to infection. Monkeypox infection usually, but not always, starts with flu-like symptoms of fever, chills, exhaustion, and muscle aches. The rash starts 1 to 3 days later and at first looks like a raised area as you might see with a pimple or bug bite. People will characteristically have swollen lymph nodes in the areas of the rash. Each of these lesions evolve to become filled with pus, sometimes with a central depression in the middle. The rash can be itchy or quite painful, especially if it is present in sensitive areas of the body. Next, these areas scab over. It is only at the point when all the scabs have fallen off and new healthy skin has formed that a person is no longer considered infectious to others. This whole process usually takes 2 to 4 weeks. Importantly, while this can be a difficult disease to endure, the mortality rate for this outbreak is extremely low, at less than 0.5%. During the infectious period, people should isolate at home, recognizing that this is a hardship as it can last for weeks. This can also be difficult if living spaces are shared, so it is important to keep the rash covered, wear a well-fitting mask, avoid contact with others and with surfaces in common areas, and to clean those areas often with disinfectant. You can use a hand sanitizer as long as it has at least 60% alcohol, or you can wash your hands with soap and water. Also, avoiding contact with pets will reduce the risk of transmitting the infection to them. If you think you've been exposed to monkeypox, or if you think you could be infected, it is important to contact the Department of Health as soon as possible to arrange testing and to assess eligibility for potential treatment with the oral antiviral medication called tecovirimat or TPOXX, and also the monkeypox vaccine. Those at high risk for acquiring the infection may be able to get the vaccine as a preventive measure, depending on the local availability of the vaccine. Although the number of cases continue to rise nationally, this won't be anything like COVID, because monkeypox doesn't spread easily like COVID. The main way it is transmitted is by prolonged, close physical contact. We at UF Health are closely following the monkeypox outbreak, and our providers are ready to identify and treat people who are at risk for this infection, who are exposed to it, or who develop it. You can keep yourself safe by avoiding prolonged, close physical contact with the person who has the rash or their personal items. You can also keep up to date with the latest information by checking the monkeypox website available from the Centers of Disease Control and Prevention. Thank you all for your attention and be well.